Question, external beam radiation, does that mean the beam enters the body from outside the body, or do you
Yes.
open them up first to expose them?
Yeah, it's completely non-invasive, so there's no, cutting or any needles involved with external beam radiation therapy. It literally is so you're laying on this table, flat, and there's a machine that's doing a 360-degree rotation around your body, and it's stopping at various angles and targeting the prostate. So it's completely non-invasive.
And it's focused.
It's-
So the point is in fractions of a centimeter or millimeter.
So when we treat the whole prostate. So it's not necessarily a focused dose, and there are kind of fingers of lower dose that are around the prostate, but the prescription dose, the dose that we're trying to get into the prostate to cure the cancer, is very tightly conformal around the prostate gland.
Yeah. I had external beam. I had a 7+. You talk about what the PSA does. It took at 6 months it had dropped down to 1. 18 months it finally got below 0.5. That was 13 years ago.
Congratulations, you've done really well.
And it's the maximum is between 0.27 and 0.34 is what it varies
Yeah.
annually.
You're in good shape.
So very successful. I had 44 treatments. And I had some antigen also because I had enlarged prostate to reduce the size of the prostate that they were working on. And working out in the gym, I had to back off maybe 10% on some of the 20 pieces of equipment I used over the 3 months that I was having the radiation. So it really didn't tap my, and within 3 months, it was back having sexual activities at comparable.
Sounds like you had a good functional outcome and a good biochemical response, so congratulations, that's great.
So external beam can be successful.
Definitely, yeah.
Any other questions?
Real
Got
quick,
time for one,
is
two more.
smoking still the #1 cause of lung cancer? And I just read where there's a lot of hope now for lung cancer patients.
Yes, smoking is definitely the biggest risk factor for developing a primary lung cancer. The biggest change that's been made probably in lung cancer recently has been screening protocols. So there've been some randomized studies that have shown that in smokers that we probably ought to be getting CT scans periodically so that we can pick these up at earlier stages. Success rates are much better with stage 1 lung cancers than they are with stage 4s. So.
Okay.
We often do community outreach events and talk to men and their spouses about prostate cancer. What would you suggest to a gentleman who comes up to you and says, how can I prevent prostate cancer? There are several doctors now using the E word a lot.
Exercise.
Regular exercise.
Yeah.
And I think that's a pretty good thing to tell them to be careful about. Diet's important too, but exercise seems to be prevailing as a buzzword.
Yeah, I think exercise is good for many reasons. Interestingly, if you look at causes of death in prostate cancer patients, they're more likely to die of heart disease than they are of their prostate cancer. So, heart disease is one of the big killers in men in this country and in women too. So I think exercise is great. Whether it prevents prostate cancer or not, I don't know. I think the jury's still out on that, but I will never discourage anyone from exercising. I don't, what can you do to prevent it? There is some data to suggest that, diets high in animal fat may predispose to the development of prostate cancer, but I don't really try to steer patients in any particular direction in terms of diet other than having a well-balanced diet.
When
You want to know what's going on outside of our borders, and whether brachytherapy is having similar success, if not more so. Where do you go? Where do we turn to find out what the rest of the world is doing other than 5% here in our country? Is Europeans in particular, or the Australians, having success with other than brachytherapy, or are they using brachytherapy and finding the similar success you find?
Yeah, it's a good question, and I'm gonna, I don't have a good answer to that. My focus is on brachytherapy and external beam radiation therapy as a radiation oncologist, but, the best, if you, wanted to explore these things, I mean, you seem like a pretty sharp guy and that you could probably track this information down, go to PubMed, pubmed.org,
Okay.
and, type in, high flu and biochemical control rates, and you will get, the library of the NIH, a whole list of different articles that you may not be able to pull the articels themselves, but you'll get the abstracts, and, you'll know what the
I'll do
patient
that, I've never done
population-
that. I did go to the medical library at OHSU, and I found that a lot of publications outside the United States aren't subscribed to. And so then also this article that I really wanted to see was not accessible unless I wrote and paid my monies to the organization outside our border.
Yeah,
It
you
becomes
may,
expensive.
yeah, you may actually, if you find an article on PubMed, and you have access to an academic institution like OHSU, you may be able to go to the librarians there and have them read those articles.
Oh, really?
Yeah.
Okay.
So if there are abstracts that you like, you can say, hey, this is interesting, it looks like they had a great deal of success, I want to know more about this group and this author, they should be able to probably pull
Thank you very much.
the full-length
Appreciate it.
articles for you.
Yeah.
Well, thank you very much. Very informative. You're welcome. So next month, what do we have next month? May.
Jack, who
Madigan,
do we have next month?
Madigan.
That's right. We have a doctor, a urologist from Madigan. We're gonna learn a little bit how the Army does it, or how the military does it.
In the field?